Hello friends, I am Dr. Vijay K. R. Rao, Consultant Rheumatologist at Divisha Arthritis and Medical Center, Bengaluru. Welcome to this video. Today I am going to familiarize yourself why women are more affected with any autoimmune rheumatic diseases such as rheumatoid arthritis or lupus. This disease is predominantly genetic. Not all people with genes develop the disease, so it's not hereditary, not something which you have inherited from your parents. So genes are like switches, something can go wrong in your body and the genes may mutate and communicate to the immune cells to attack your own body, such as joints or other organs, causing autoimmune diseases. Apart from genes, hormones plays a major role. Female hormones, especially high estrogen content, is the one which mostly mutates these genes and primes these genes. And hormone fluctuation period, especially puberty, when a girl becomes a lady, pregnancy or delivery, when she becomes a mother, or menopause when she becomes a grandmother, I wittingly say that. So those are the periods when the genes can undergo mutation or changes and can communicate with the immune cells to attack your own body. Apart from this, stress is a major factor. Woman in a household is the major pillar of every family. So woman absorbs a lot of stress and keeps all the men going. And that is the main reason women absorb a lot of stress and develop these diseases, because to keep their family happy and to protect their children or husbands, they eat food very late, they exercise very little, and they sleep very less. And less amount of sleep or reduced quality of sleep, lack of physical exercises, and not a proper diet, such as lot of red meat diet can cause this disease, high sugar, high fat content can cause this disease, and lack of physical activity can cause this disease. So taking all these precautions for the women of the family is very important to keep away from autoimmune diseases if they have family history, and also if they have known autoimmune diseases, to engage in good physical exercises and healthy lifestyle so that their dosages are very minimized. Pregnancy is an important part of every woman's journey. So it's a myth that autoimmune rheumatic diseases or rheumatoid patients cannot get pregnant. That is false, my friends. All patients can enjoy pregnancy. A rheumatologist who is trained to deal with these diseases, who after their medicine learns immunology and their medicines, after their general medicine, they learn this in their rheumatology degree. They are trained to identify any problems in pregnancy, make sure that the tablets are not causing problems. Not all tablets are bad in pregnancy. There are a few which are safe in pregnancy. Your lady doctor or gynecologist may not know this. So talk to a rheumatologist. Do not stop tablets suddenly. Most tablets, if changed or swapped within 1 to 3 months before pregnancy, are safe. And rheumatoid arthritis in particular gets normal in pregnancy. It's post delivery that arthritis flares up, and that is when we actually manage in terms of the flare up of an arthritis. It is important that the arthritis is under control during pregnancy, otherwise the baby growth is not very good and can lead to early deliveries, or what we call preeclampsia or high blood pressure in pregnancy, or even small growth babies. So if tablets taken in the right form, right duration, disease is kept in a low severity, you can achieve a normal pregnancy. Certain precautions in certain types of diseases like lupus, where Rho antibodies is one antibody which can cross the mother's placenta and enters the baby's heart and cut the electrical wires. We call it congenital heart block. That risk is 1%, 1 in 100. It is very rare. So if detected early through a fetal echo done from 16 week onwards, then the treatment can be initiated. So do not heed or listen to the myths about pregnancy is not safe in rheumatic diseases. They are very safe. Tablets are not safe in rheumatic diseases. They are very safe if decided by a rheumatologist and in consultation with a gynecologist. And your baby will not have autoimmune disease per se, because that is not a heritable disease. Hope this video was useful for you. I wish you all the very best in your journey. Thank you very much.